My name is Pam Burgum. I am a speech-language pathologist, and for the past 25 years I have been working with hard of hearing adults. I'm hard of hearing and wear a hearing aid myself. I teach speech reading and communication strategies in addition to doing educational presentations on hearing loss throughout the community. Today, my colleague Diane Contreras and I will be talking about hearing loss, how it affects the individual and the people communicating with them. There will also be information about hearing aids and assistive listening devices. Hearing loss is a common problem in modern society. This is due to the combined effects of noise, aging, disease, drugs, and heredity. Hearing is a complex sense involving sensitivity to the ear as well as the ability to understand speech. All people with hearing aids are different. No two are alike. Hearing aids are not like glasses. They help, they do not correct. The benefits an individual has with hearing aids depends on two things: the amount of residual hearing they have and the amount of word recognition or understanding. Residual hearing is the hearing that a person has without their hearing aids on. Word recognition is determined by a test that will tell a person what percentage of 100 words they understand. Everyone has a different percentage. Now we're going to give you an unfair hearing test. You will hear a list of 10 words that will simulate a common high-frequency hearing loss. Write them in a column. Let's begin.
Word number 1, who. Word number 2, who. Word number 3, ma. Word number 4, da. Word number 5, ma. Word number 6, mo. Word number 7, pa. Word number 8, Word number 9, go. Word number 10, ball.
How did you do? I'm sure none of you got 100%. Just think, this is how many of your patients hear all the time with a hearing aid on or not. Let me tell you, 30 million people have hearing loss, but only 1/6 of them have hearing aids. 15 out of 1,000 people under the age of 18 have a hearing loss. 25% of people over the age of 65 have a loss, and 90% of people over the age of 80. Roughly, that means 1 in 10 have a hearing loss. These numbers are increasing every year. Now my colleague will talk to you about types and degrees of hearing loss.
Hello, my name is Diane Contreras, and I'm an audiologist. Audiologists are healthcare professionals who identify, assess, and manage disorders of the auditory, balance, and other neural systems. I'd like to start by discussing various types and degrees of hearing loss. When an audiologist performs a hearing evaluation, they obtain a graph. This graph displays that individual's specific results, and it's called an audiogram. You can now see an audiogram of familiar sounds. This graph shows the softest levels that an individual can hear various sounds. The audiogram shows frequency and intensity. The following are some examples of different sounds at various frequencies and intensities. There are three different types of hearing loss. The first type is a sensorineural hearing loss. This type of hearing loss occurs in the inner ear, the auditory nerve, or the parts of the brain that receives nerve impulses from the auditory nerve. The second type of hearing loss is called a conductive hearing loss. This type of hearing loss occurs in the outer ear and/or the middle ear. Something prevents the sound waves from reaching the inner ear. The third type of hearing loss is a mixed hearing loss. Mixed hearing loss occurs both in the outer or middle ear and in the inner ear. It's a combination of a conductive and a sensorineural hearing loss. Often you have both a loudness and a clarity component to the hearing loss. Sometimes medical or surgical intervention can help but not correct this type of hearing loss. Next, I'm going to talk to you about the specific degrees of hearing loss. Hearing loss is classified by degree, ranging from the softest level that an individual can hear sounds to the loudest level an individual can hear sounds. Normal hearing ranges from 0 to 20 decibels. A mild hearing loss ranges from 21 to 40 decibels. A moderate hearing loss, 41 to 55. A moderately severe hearing loss from 56 to 70, and a severe hearing loss, 71 to 90 decibels. Any profound hearing loss is 91 decibels and higher.
Hearing loss is often gradual. Others notice it before the person themselves. Many older adults deny hearing loss. Here are some of the signs of hearing loss you may see in your patient. A listless and weary expression. Frequent requests for repetition. Mispronunciation of words. Turning one ear to the speaker. Voice or speech difficulties. Complaining that people mumble or speak unclearly. Failure to respond when questioned or laugh at a joke, or playing a radio or TV too loudly. There are also many emotional reactions to hearing loss.